Good morning, and thank you for joining us for our webinar on physician leadership and versatility styles. My name is Vicki Radcliffe, and I will be your moderator today. Before we get started with our presentation, I'm going to review a few basic reminders and instructions for our audience. We are experiencing a slight glitch with the live meeting software, and so when you join this meeting, you may or may not have seen a dialog box that came up asking you to have the computer system call you in order to hear the audio along with the video that you're seeing on your screen. If you do encounter this dialog box, you do not want to do that. You want to go ahead and use the dial-in information and participant code that you received in your confirmation email when you registered, and that's the same number and information that you see up there on that first slide, and that will be copied for the next couple of slides as well. If you have any issue getting online during this presentation or issues calling in, please call our front desk here at 612-339-0919, and they'll try to assist you in getting logged in. That number again is 612-339-0919, 612-339-0919 for our front desk in case you have any trouble getting logged in or called in. We want to make sure that you use the dial-in number and conference code to get in and are not letting the system try to call you. That said, we also want you to know that all participant lines have been muted for the entire presentation, and this is just to reduce noise and distractions heard on the line. At the end of the presentation, we will allow time for questions and answers. If you have a question you would like addressed, you may type it in and we will read it off for you. To do so, please click the Q&A button that you see on the top menu bar at the top of your screen. Just type and submit your question, and we'll go ahead and do our best to make sure that it is answered. Finally, all participants will receive a copy of today's presentation following the webinar. Our presenter today is Jim Rice. He is the Executive Vice President of our Governance, Leadership, and Executive Compensation Practice of Integrated Healthcare Strategies. Mr. Rice is also the Director of the International Health Leadership Program at the University of Cambridge in England, and he also serves as the Vice Chairman of the Governance Institute. Now I'll go ahead and pass off to Jim and let him begin the presentation. Jim?
Thank you, Vicki. Good day, everyone. Thank you for joining us. I know that when I participate in these webinars, I like to know whether it's worth my while to stay with the seminar. So I'm going to give you the key bottom line right at the beginning, and you can be the judge if you stay with us throughout our approximately 45 slides. We're going to share information with you for around 40 minutes and have an opportunity for some exchange of questions and comments near the end. So thank you again. We have an important set of information that we're going to be covering. The bottom line that I'd like you to keep in mind is that we know that we need position alignment. Position leaders in a wide variety of roles and responsibilities are a critical and essential ingredient for that position alignment strategy to take hold and to be successful. And here is the bottom line for this particular webinar. We've concluded after our studies over the last 3 years and some work that we have been doing in England for the last 14 years on leadership development in the health field, that physician leaders need to pay attention, and the colleagues on this webinar would be wise to invest in the development of the soft side of leadership development. It's not so much the metrics of quality and safety or understanding clinical service line financial statements as it is 3 dimensions or soft variables in leadership development. The first is self-awareness, the second is interpersonal relations, and the third is listening and engaging skills. So this webinar will show you how we've drawn conclusions on that and how some successful healthcare organizations are developing their physician leaders to balance those soft variables with some traditional economic and project management types of elements as well. So we're going to be making this assertion, as you see on the bottom of our opening slide 2, that versatile physicians are much more likely to be successful. On this next slide, we have a reinforcement of what I believe most of us know that are participating in this webinar, that this industry is changing. On slide 3, if you read with me from left to right, you'll notice that we used to focus a lot of our healthcare delivery activities, our anxiety over payment, our focus on quality, the various ways that we engage with our clinical collaborators, nurses, allied health professionals, and physicians, but very much focused on the 15-minute encounter. That was at an era from 1985 to 2005 when 70% of our preoccupation was in the inpatient setting. This whole set of relationships and this continuum of care is evolving rapidly as we go to the right from 15-minute encounters to where we are engaging with our clinical partners to manage the patient and the family experience into 15-day encounters. A large part of this is driven by the move and our understanding of the critical role that chronic disease management is going to play in all that we do. So our physician alignment strategy is going to have to pay attention to the movement toward chronic disease management and interdisciplinary teams, and the physician leader profile in terms of the competencies they need to master must also help them be more successful in this journey to the right of this chart. We are speculating that over this next decade, as we move from today through the summer of the year 2020, increasingly our economic success, our quality success, our market position success is going to be driven by how we can engage in managing 15-year relationships. Our physician leader partners must help us make that happen. So if we look at over the last 20 years and going forward a year, we're going to be looking at the movement of physician leadership being focused on 15-minute encounters toward 15-day episodes of care to 15-year relationships. This next slide reinforces this. This is from a recent analysis done on the implications of the Obama reform package prepared by the advisory board. If we look at the movement of the prospective payment system that we're all working in on the left side of this slide, we will be, I think, accelerating through this journey of episodic care and managing costs of episodic managed care initiatives into a preoccupation with the total cost. And as we move toward bundled payments, the physician leadership that we need is going to have to be acknowledging the skills and competencies necessary for this journey of movement toward provider cost accountability, ever more important and ever more in the center of the radar screen. We all know of the multiple relationships that we're all working on. We're trying to develop everything from hospital joint ventures to employment to new investments into management service organizations to support practices of physicians. Most of us understand, therefore, the critical role that physician leaders play. The kinds of activities that we're seeing across the United States are captured on slide 6, 12 important elements or areas of concentration of physician leaders. I'm not going to mercifully read through these, but as Vicki indicated when we launched this webinar, all of these slides will be available to you, as well as the audio recording for your use with your staff and groups following this webinar. But you can see from these 12 areas that physician leadership effectiveness is important. And one of the things that we've concluded is that the development of the social style, the versatility of how physician leaders interact with their physician colleagues, nurses, other managers, boards, and frontline workers is going to make or break their success in these areas. We've intentionally given you a very complex and confusing exhibit on slide 7. This is not too dissimilar from what you would find in your own organization. We've been pulled in frequently now to help document what is the need and the scope and nature of physician leadership. This is a Midwestern hospital that found out they were spending millions of dollars for a mixed bag of medical directors, and were wondering whether they were getting good value from the investments into the development of those physician leaders. They have over 90 physician leaders. Most are part-time. Some relate to teaching. Some relate to the classic medical staff roles. Some, they've organized their 600 physicians into 5 divisions with a number of subsections, and 56 medical directors that range from quality to safety to service line management to rural outreach and the like. The importance that we need you to take away from this chart is that all of you will be developing more physician leaders, and the rest of this webinar is to look at some key competencies that those physician leaders are going to need to master. On this look at the process that most of you are going through or should be going through, you start at the left, which is the future environment is changing, number of threats and opportunities, and so many of you are starting to look at how do we develop both the traditional medical staff leaders, but also increasingly moving into the medical directors. And how will you appoint them? How will you give them clear job descriptions? How will you develop their competencies? So as we have as a focus of this webinar on the development of a versatile style, we want to make sure that you anchor that discussion and that investment in the broader context of your physician alignment philosophy, the physician alignment strategic plan, the medical staff development strategy, how you're finding, developing, recognizing, and rewarding physician leaders as well, even though we're going to be emphasizing the need for versatility and that set of competencies for physician leaders. For those of you that have not yet developed your own version of a physician leadership training program or a physician leadership academy, a good useful resource for you is shown in the website on slide 9. This is studies that were conducted by collaboration of the American College of Healthcare Executives, Health Financial Management Association, American College of Physician Executives, and some others. If you go to that website that you see there, Healthcare Leadership Alliance, you will find descriptions of over 300 competencies. But that, we believe, is the old school. We think the new approach to developing your versatility and your effectiveness of physician leaders will need to be driven by your vision and paying attention to a wide variety of innovative approaches to develop leadership capability. Our conclusions regarding this is a function of work we have been doing over the last 3 years. We have been doing some studies with the Governance Institute, with the American College of Healthcare Executives. Many of you have helped us by participating in web surveys about a wide-ranging array of factors that influence the effectiveness of physician leaders, factors that frustrate their effectiveness, what kinds of competencies are working better at the front line, and we're going to summarize that for you now in the next few minutes and then give you an opportunity to raise some questions. We've not been content to look just in the U.S. On slide 12, there is a very helpful leadership competency model that was developed over the last 36 months in the United Kingdom for physician leaders in the National Health Service. For those on this webinar, you can Google Physician Leadership Model National Health Service and get manuals and cookbooks about these competencies. I encourage you to use that and adapt it for the realities we face here in the United States. We have done some of that and can make that available to you, but we encourage you to look at this on your own. You'll see 5 clusters of competencies that the physician leaders in England are developing. We think they have merit for us. They're clustered into demonstrating personal qualities, working with others, managing services, improving services, and setting strategic direction. All of those are important, but the message we have out of this webinar is in the sweet spot of the intersection of all of these is the area of versatility and the social style that physician leaders embrace, understand, and deploy. We have seen the subtle and sometimes not so subtle differences between physician leaders compared to administrative or executive leaders. Those are suggested by Mike Guthrie in this study shown on slide 13. The main thing that we would like you to take away from this is that successful physician leaders have got to balance not only the tools and competencies and knowledge and skills of executives, but they have to be prepared to look at managing their own behaviors and the interactions they have with teams of other allied health professionals. What's important to focus on, we've identified 5 key measures that most of you on the phone are using as markers for leadership development. Many of them understandably focus on clinical quality, but increasingly as we look to our physician leaders, and many of us on this webinar will have dozens of physician medical director roles, the soft side of developing groups and group dynamics is going to become very important. And so leadership style does matter because so many of the things that are getting in the way of our physician alignment strategies relate to the angst and the issues of confusion and even anger in the medical staff. On slide 15, we've given you what our studies have identified as 5 key frustrations that medical directors and medical leaders have to deal with, ranging from apathy to mistrust. Probably no surprise to those on this webinar. On the next slide, we talk about why it is important to focus on some key areas. We've identified 5. Resistance from other physicians is one of the biggest frustrations to the effectiveness of physician leaders. No clear performance goals, lack of time. And the last one is very important as it relates to our webinar. Number 5 on page 16 indicates poor group or interpersonal management skills. This was one of the top 5 challenges that's getting in the way of physician leaders being able to flourish and to become more effective. Hence the focus on this webinar. Slide 17, these are classic clusters of skill areas and knowledge areas that physician leaders need to manage. Our message at the bottom of this page is that listening, communicating, and problem solving as it relates to groups and interpersonal interactions is all a part of the management of social interactions, of social style. I know that we see from those that are registered, we have a mix of medical leaders and managers and some human resource professionals. I would encourage you to Google social style because that is the context in which we're going to be more successful with physician leaders going forward. You'll see on slide 18 that many of the leadership academies that we have studied have focused on the back wheel competencies, or the harder competencies that physician leaders need to manage. Harder in the sense of being more business-like, more economic-focused, more financial. But the real key for our organizations and our health systems as we drive for integrated models and physician alignment is to encourage all of us to pay more attention to the front wheel competencies, self-awareness and skill building in the area of versatility and interaction with group settings. So we know, therefore, that we should also be informed by, and this is a bit of a tongue-in-cheek slide, what we've concluded to be essential today is not too far off of what we had shared by leaders for effective physician leaders in the year 1873. You'll see on slide 19 what they suggested back then: respect for others, non-judgmental listening, willingness to subordinate one's interest to the service of others, and etc. So we're going back to the future, if you will, by looking at the need for developing interpersonal effectiveness. Marshall Goldsmith, arguably one of the most visible and active executive coaches, shares the power of interpersonal interactions and managing the style of those interactions and the versatility of executives and managers and leaders in other businesses. You'll see from those quotes on slide 20, we need to take that to heart and invest in and embed in our leadership development for physicians that similar recognition. So the next few slides we're going to share with you the results of some work we have been developing over the last year with TRACOM, a respected research and training program out of Denver, or out of Colorado, that we have helped adapt their tools, which have been used for over 30 years in other managers and leaders in other industries, into the confusing array of healthcare, and in particular, the unique leader of physician leadership. You'll see some basic definitions for us to keep in mind, and although this webinar is only a teaser to get us exposed to some of the key lessons that we've learned, behavior, interpersonal behavior, social style in terms of how we interact with social groups, which are projects and interdisciplinary teams, whether they are to redesign care processes or improve clinical outcomes and patient safety, or even plan new kinds of health programs and health facilities. The bottom line, again, is to pay attention to the versatility of physicians. Now, when we look at, and what we have learned from other leaders and training managers in a wide variety of settings, the simplest tool that we've found is this TRACOM work on social style. They're one of the original researchers, over 30 years looking at this. There are key dimensions about control dimensions and emotional dimensions. On the horizontal, we have elements of communication. The intersection of these axes gives four dimensions, four descriptive profiles of leaders. And what we have found is that special training for physician leaders can help them not lock in on any one style, but the versatility that we mentioned on the lead slide for this webinar is that great physician leadership success is going to come from their being astute enough to understand the application of different styles of interaction in different settings for different projects for different purposes. In some instances, you'll need a driving style. In some areas, the expressive dimension, some amiable, and some analytical. For the purposes of our webinar now, it's sufficient for us to know that there are different ways to measure and to develop these styles within physician leaders. They will have undoubtedly a base or common dimension of their style for interactions and interpersonal relations. But the key is they have to be ready, willing, and able to adapt their style for the unique situations. When you receive these slides, you'll also receive access to analytical reports that you can download to give the description of these measurement tools. They're web-based and can be helpful for you. This next slide goes through an understanding of how these will come together for you into the profiles I mentioned. You can plot individual physician leaders against these styles and then provide training and discussion about new approaches that they'll need as certain styles press up against other styles. The important thing for our webinar is that you pay more attention to this, not that you necessarily have to embrace or use these tools, but that we are trying to encourage you to get more comfortable and to get your physician leaders more comfortable with moving from low versatility to high versatility. That sensitivity comes with training and education about self-awareness, and to build into your leadership academies new information about the development of these skills. On slide 26, we'd like you to keep in mind, therefore, the need to not only pay attention to this, but I want to give you what we've found to be some key dimensions of the training side of turning physician leaders into better mentors and to be more receptive to be mentored. Reading skills. We will provide reading information and backdrop for all that are registered for this webinar about the power of this effectiveness. We've also found that mentoring, some new approaches to rounding, some case study dialogue, case study-based discussion on how to engage in listening and communication skills, better group dynamic understanding, project management, social psychology are all dimensions of this new era of physician leadership skills. We've gone through and shared with you from some of the other industries and the materials you will receive after this webinar that look at these dimensions on slide 27. Item number 5 indicates that the research over the last 15 years shows that higher versatility, in other words, being ready, willing, and able to interact creatively and sincerely with other groups and other professionals, can be a straight line relationship to improved effectiveness and better performance of the individual physician leader, but also of the groups. So we're going to go through just a few more moments and slides on what we found to be some of those attributes and skill sets that the interpersonal social style must function within. You'll see on this next slide 28, the attributes must balance knowledge, skills, and attitudes. There are dimensions of interpersonal interactions that embrace all of these. You'll see a set of key elements of knowledge on slide 28. You'll see on slide 29 some of the key dimensions of skills and attitudes. You can look at these and see that the verbal and engaging and strategic thinking are woven into the lessons we've learned about what it takes for successful physician leaders. The key, though, is what do we do once we've found great leaders and we get them to sit through some interactions to develop the knowledge and skills and attitudes? Dr. Peter Person from Essentia Health in Duluth, Minnesota, has concluded on slide 30 that once selected for leadership role, physicians must be supported to excel. We have to continuously invest and continue to invest in their development. It's not a one-time investment, as I'm sure our colleagues on this webinar understand. Factors that we're going to have to weave in and around the development of social skills and interpersonal relations also must be supported by infrastructure. On slide 31, we know that the job descriptions must go with this. It's not enough to find talented leaders and ask them to serve. We're going to have to invest in the design and development of tools for them to be effective, not the least of which is mentoring skills so they can mentor, but also that they acknowledge and understand that to be mentored is not to be earmarked or painted as a weak manager. They need to think back to their residency training and recognize that the most pushy, most obnoxious, most talented chief residents that really help them learn at the bedside are equivalent to the kinds of mentoring arrangements that can be structured in our hospitals and health systems to make sure that these new skills for success can also be fostered and developed. We've learned this in this last year. Some of I see who has registered for this webinar have participated in a previous webinar we conducted that was focused on programs of promise, where we have analyzed the leadership development programs in these 10 respected healthcare organizations. They range from Cedars-Sinai to Allegiant to Baylor to Mayo to Advocate. We've continued to document the competencies, the curriculum, the training methods and motives of these various programs, because it's within these broader competency development initiatives that the focus on social style and versatility must be anchored. Previous webinars that we've conducted, a series of white papers on what we've learned about physician leadership academies are also available to you free from our website. 3 lessons we've learned by looking at those respected leadership development academies are that the successful programs really require continuous attention on physician leadership development, and that this requires balancing clinical and leadership competencies, and that the training materials, and we have articles that you can again download from our website, focus on rounding, practical case studies, bite-sized learning experiences where they sit for a couple of hours, get the tools that relate to, and not just reading an article about versatility, but they have to practice the development of interactions and behaviors that foster good interpersonal relations and group management and project management dimensions. One way to look at the overall system that we need in which versatility can be developed and can flourish is the 10-component system shown on slide 34. It's our experience that the great programs that are going to be sustainable and will be increasingly shown to have high performance must have all 10 of these dimensions. Very clear leadership positions defined, and they have to be linked to recognition and reward and performance appraisal. I will be mentioning at the end of the webinar, which we're coming to soon, where I'm reminding you you can send us questions regarding this topic of versatility and how leadership development programs can develop this. The next slides that you'll be able to review once you receive the slide set describe what each of these 10 components need. Leadership positions have to be defined. We're all familiar painfully with RAC audits that are looking at billing and compliance with CMS regulations. We believe those auditors are going to look more carefully at physician leadership positions. Do they have real jobs? Are they being compensated legally and fairly and appropriately? And is there a paper trail for those job descriptions? You need to have the rigor and the discipline of your overall leadership development strategies and structures to guard against or to inoculate yourself from those potential threats. So you have org charts, you have position descriptions. The third element that you'll see, is the recruitment of key physicians that have the potential to flourish as physician leaders. You'll have to increasingly be looking for those that not only have good clinical skills, but have the potential to really shine and flourish on their versatility or managerial interpersonal interaction, knowledge, skills, and attitudes. We also have to do a better job as an industry to measure the performance markers or the metrics that physician leaders are expected to meet. One of the things that we found in interviewing physician leaders this last year is they're very frustrated that they're thrown naked into the briar patch without a lot of support and clear understanding of their roles and responsibilities and the kind of support that they need. Those of you on this call that are using the dyad or the partnership where you've got a physician leader teamed with an administrative leader are going to be much more successful by balancing those collaborative kinds of skills. If you go to orientation programs, most could do well by sharpening up what you're doing, raising the bar on orientation. Please build into those orientation initiatives the recognition of the power and the importance of social style and of versatility. The developmental activities that you see on slide 40 are absolutely essential, and of these, the one that we want to highlight is mentoring, two-way mentoring. Physician leaders have to be supported to become better mentors, and they have to be willing to accept mentoring, especially as it relates to style of interaction in varying settings. That means support is going to be necessary. Most of you will need to, over the next 5 years, completely re-engineer and reinvent your medical staff office. The medical staff is actually much more antiquated than we're willing to admit, and we need to invest a partnership with our finance team, our human resource teams, and our medical staff offices to come up with new tools and support activities for one of our most important ingredients for success, which are physician leaders that can master the versatility of their style. That means that we also have to do a better job of doing performance planning and performance appraisals for medical directors. Most of us have done a poor job with our senior executives on performance planning and performance appraisal, although thankfully that is improving over the last 3 to 5 years. But we have done further work, and we will have another webinar on May 27th that you'll be seeing at the end of this webinar, where we're going to share what we're learning on how to do performance reviews for medical directors. This must be linked to recognition and reward. Incentive pay is good, but there's a wide variety of other recognition tools that we're finding that are woven into the medical director development programs, and the broad comprehensive approach to talent management or human capital management for physician leaders is absolutely essential, and you must, just as we talk about continuous clinical quality process improvement, we must also look at continuous process improvement in the way we find, develop, recognize, and reward our physician leaders as well. So please keep these 10 building blocks in mind. Centered in this whole arena is the area of versatility, of style. As I started on this program, the bottom line, I'll repeat again for you now, and then we'll see if we can answer some questions. First of all, you must build into your physician leadership program training, readings, case study opportunities, and mentoring on self-awareness. The second of the 3 key building blocks for better approach to versatility and style is to invest in modern understanding on interpersonal relations. Borrow ideas from other organizational development staff and bake that in, hardwire that in, if you will, to your physician leadership development programming. The third dimension is to invest in better listening and communication styles and skills, particularly in small groups that have interdisciplinary and interdepartmental team members, because the physician leaders are going to feel a greater sense of accomplishment, greater pride, greater results, higher performance when they can marry the soft variables of versatility into the harder variables of designing projects, doing clinical process improvement. And so lean and all your other training and investment programs need to be spiced up and enhanced by an embrace of versatility and these three dimensions of self-awareness, interpersonal relations, listening, and communication. Thank you for paying attention to this. Again, you'll be able to receive downloads from our slides and support materials after this webinar. Let's see, Vicki, if we have a few minutes for just a couple questions, please.
Absolutely, we do, and we'll go ahead and take those in a moment. Quick first, I'd like to give another reminder on how you can submit a question if you'd like. Type in the question to have read off by using the Q&A button at the menu bar at the top of your screen. We'll read it off and answer it for you. That said, we'll go with the first question I received from our audience today. They ask, versatility and style seems like a difficult concept for physician leaders. How do we make it work?
I wish I had a fast, easy answer to that question. It is a good one. First of all, just framing the question is healthy as you are looking at putting in place an update or an upgrade to your physician leadership development academies or training programs. Have conversations about that. I had a very interesting conversation with a retired physician executive here in Minneapolis that is involved with St. Thomas University. They have developed a leadership training program, and they have redesigned their training to build in dialogue and self-awareness training. So the first response is to say that it's not a dirty word to talk about versatility and social interactions, interpersonal interactions. In fact, for the last 3 years here in the St. Thomas Physician Leadership College, they've gotten very nice correspondence and remarks back from spouses that say, thank you for having a piece of that training program focused on style and interpersonal skills. It has helped this physician spouse of mine even off the job. So it may be awkward and difficult, but I would encourage us to keep the conversation going, keep asking how you can borrow ideas from local college folks that know organizational development, interpersonal communication, listening skills, and the like. So I know that's a long-winded response, but the important thing is to make sure you have discussion about it and build innovative approaches into your mentoring and case study work experiences.
Okay, thank you, Jim. Go ahead and take our next question here. This participant asks, how do you balance development of quote-unquote style with other competencies physician leaders need?
I know that we went through that fairly quickly in the webinar, but there are assessment tools, a variety of them to assess the current self-awareness, the personality styles, the interpersonal profiling. There are 3 or 4 classic tools that I'm sure people on the webinar can find from social psychologists, from management training, and the like. So one is to make sure that the assessment of personality and the existing style can be done. We've introduced one that we're using in this webinar from the TRACOM organization, which is looking at social style, questions that can be posed on that. The other is to build in special case studies. How would interpersonal relationships make or break a challenging situation where you may have a disruptive physician? You may have a new program that you're designing for earning and managing rural referrals, and some of the style of the referring doctors doesn't mesh well with the style of the recipient physicians. And how does a physician leader inject themselves between that and understand how to best manage that? The key message, I guess, in responding to the question is give it as much attention as you would to clinical process improvement skills, to reading financial statements. You must also embrace understanding and managing social interactions and versatility or situational leadership skills.
Okay, very good. Thank you. Looks like we have time for at least a few more. I'll go ahead and take a couple more of those. I just want to let our participants know that if we do not get to a question that you have asked, then we will be sure to follow up with you and answer them in that way. Our next question coming from Martha is, are organizations doing an overall good job of integrating these learning approaches to benefit both the executive and physician leadership, or are there tendencies to silo this learning?
It's an excellent question. I think the painful conclusion we've reached is that as an industry, we are not doing a good job of this. We have underinvested in the development of interpersonal style and versatility on our executives for probably 30 years, and now over the last 5 years, when we're really starting to pay attention to the development of nurse managers and physician leaders and physician managers, we're woefully weak as well. So I think it is fair, unfortunately, to say that this is getting pigeonholed or siloed. I'm hoping that through these little webinars and through the almost 100 people participating in this webinar, that you will help be a champion to break through those silos and say this is a legitimate topic for physician leadership development.
Okay, we'll try taking this next one here too. We have many physician leaders seem to eventually transition out of clinical patient care. After even a year of this, they seem to be out of touch with fellow providers and relationships struggle. How do you avoid the full administrative mission creep that comes naturally with a successful physician leader?
Excellent question. We've been worried about that for the last 5 years that we've looked at that. Let me give one response from the work we've done over the last 14 years in England, the business school at Cambridge University, where I have helped put this new physician leader program in place. They've concluded that you can't really get away from the creep, that although for 3 or 4 years they try to have physicians wean themselves off of their clinical roles, they try to resist it for as long as possible. It goes from 25% administrative functions to 30 to 50 to, and eventually, once you get in the middle, about 50% clinical and 50% management, it drives them so berserk they can't really sustain it. And so then they jump quite quickly to a larger concentration of leadership. We're starting to see the same thing over the last 5 years in the United States. The American College of Physician Executives is starting to look at how to seek that proper balance. Most try to keep some activity where at least a couple times a week a physician leader does something clinical on a consultative basis, but it is difficult, and I don't think that we're going to find an easy answer for that. The last comment I would make about what we've seen from some of these high-performing programs of promise that we've been studying is they acknowledge that it is okay to influence a few thousand more in terms of their health and well-being by mastering some leadership skills that are different than what you would do as a clinical physician. Sometimes we also have to acknowledge that physician leaders get frustrated when they get so insulated or remote from their passion and their calling that we've got to make sure we don't burn them out or get them so frustrated that they leave both clinical and administrative activities, which unfortunately we're seeing for some 58-year-old doctors that are now engaged in leadership roles. So those on this webinar would be very prudent to be cautious about how fast the migration goes to administrative activities. Make sure you always build in opportunities to reconnect with frontline clinical delivery, patient care, so that that passion can still be at least a glowing ember and not completely snuffed out.
Okay, very good. There's one last question we're going to take here, and I think this participant may have already dropped off, but we'll go ahead and answer it for the group, and that way we'll have it in the recording as well. Jane had asked, we are a faith-based organization. Can you speak to this element being included in your physician leader development?
Yes. One of the other areas that we have not covered on the soft side of leadership development. We've emphasized interpersonal skills, the versatility of social style, but there's a good body of knowledge that shows in leaders, even outside of our field, outside of healthcare, that the spiritual dimension does influence the effectiveness of leaders, whether it's in projects, teams, departments, or whole enterprises. There's a good bit of knowledge and study that's coming out of research in Harvard, and internationally this has become evident as well. So the social side of faith-based organizations, reconnecting or grounding what leaders do and why they do it for the benefit of patients, and the recognition that the healing process of patients is influenced by a wide variety of interventions, pharmacological interventions, manipulation, the marriage of Eastern and Western thought and medical principles and systems is becoming evidence-based. And so the spirituality and the dimension of faith-based organizations should not be overlooked as we develop our leaders, whether they are physician leaders or other executives. And in fact, we are seeing in work we do with the Governance Institute that boards are also building into their competency set the need to embrace the softer side of leadership. I hope that will be helpful for Jane.
Okay, thank you, Jim. I think that's all we'll take for questions right now. We have a few minutes left, and we do want to make a few just closing comments here. On your screen, you can see the contact information again for our speaker. If you have further questions or would like to have a discussion with him, please contact or email Jim directly at the information you see listed. As we've already noted, all registrants will receive a copy of the slide presentation, and then in a few days, a recording of this webinar will be available on our website. Just visit ihstrategies.com and now navigate to the Knowledge Center. There you'll also find other resources like articles and white papers. On our final slide here, you'll see we do have an upcoming webinar that Jim already noted earlier. It will be on Physician Leader Performance Reviews on May 27th, again from 10 a.m. to 11 a.m. Central Time. To register, you can go to our website, again, www.ihstrategies.com, and go to our events page where you'll find a link to register for it. Or you can wait for the email invitation, which will probably be coming to you soon, and register via that. Jim and I thank you for joining us, and we hope to have you join us again for our upcoming webinar. Have a great day. Thank you.